This towel is folded and a few times twisted. I put it behind the leg, and I can now move the foot in front, and I can adjust here the pressure on the foot. If you have an ankle injury or something, any of this could already be much too much. So act accordingly. You have such a bar, and then you hang, but you hang always on one arm, and then over to the other one. And you interchange this as long as you can. Doing this is a down. You take the bar wide, then you hang, and then you try to come up to one side, try to move straight out. That way. You find yourself a bar, and you take it with the hands from the bottom, and you drive it down, and then you pull up the beam over. That is it. You find yourself a bar around the chest line, and then you take the foot on the front, and you drive it down, and then you go up. Make a lunge back when you come up, and you make a front kick. You're standing, when you make a lunge backwards, a front kick in front. When you sit down, one leg down, lunge, and kick in front. You're standing, and when you take one leg back, the knee can come over the foot, but you try to stay tall. Try to stay tall, and the knee can come over, but with a flat foot on the ground and all turn in one direction. The feet almost together, and then up into tiptoe, and down again, and up, down. And also go more into the knees, and then up. And you can also do with one foot. On the mat, hands underneath the shoulders, knees underneath the hips. Breathe in and out up the back. And take a posterior pelvic tilt. Then in the neutral position. And out, down the back and anterior pelvic tilt. Again in and out. The toes are pointing to the outside and the heels are standing around shoulder width wide apart. Then you bring the arms up, you breathe in and out, and you go down. Then you go into the garland pose, and you try to make a straight back. You breathe again in, and out you come straight up first with the crown of the head. Up again, and then breathe in, go down again, and out. Get into the garland pose, breathe in, straighten up, and out with the crown of the head first up. You can do this very slowly. Up again, and you can repeat this a couple of times. On the ground, you might start with a tabletop, the knees together or slightly open, and you just go back, the arms in front and the head to the floor. Variation of the hands behind and the palms to the sky. Take the bar from the back, you hang with extended arm, then you pull up and then go down again. Set up and you can up, down again. Set up all the way, small, you hang down, and down again. You have a bar like that, you take one like that, and you come up to one side and go up to the other one. And you can change a couple of times. One side and then up to the other one, and you can change a couple of times. Be warmed up when you do this. You bring one leg up, bring it to the outside, up, and again in. The other one, up, to the outside, up, and in. And then you repeat, up, to the outside, up, in, up, outside, up, and in. This is an exercise which is done on the floor, so you go into normal plank position. The hands are a little bit further apart than normal. And you have a straight back and the tailbone tucked in. When you come with one knee close to the hand in front, and then with the other hand close to the hand in front of him, and you change this a couple of times. You're on the ground, the legs are standing like that, hands behind the head, and you go to the side. Back and to the side. The back keeps lying on the floor, you go only half up and the shoulders up. The hands are not pulling on the head, they are not helping, they are just there to add weight. And to the side. And you should always do this to the other side. You're on the ground and the legs are standing like that. And then you bring the hands behind the head and you come up only halfway. The back keeps lying on the floor. And the hands behind the head are not there to help you, but to make it harder, adding weight into this direction. So they are not pulling on the head, they're just here. Settle onto the head, but they are not helping. A little squat and back. Squat and back. Squat, back, squat, back. You can let the arms hang, or you take the same arm up as the leg goes behind, left and left. Squat, back, squat, back, squat, back, squat, back, squat, back. You have a good and stable stance. The arms to the sides, and then you do circles with the scapulas to bring them together, up, to the side, down, together. You can do it slowly and control it, also as 4-point circles. You can do it also a bit faster and also into the other direction. Take the bar from the back, chin back, and then you go. And then you just keep hanging with the chin over the bar. So it's the exercise, just keep hanging as long as you can. You have such a bar and you just hang. And you do it as long as you can, that's the exercise. Doing this is at your own. Just normal plank, but that you have the palms facing downwards. You start a normal plank, but just in dolphin plank, so the palms to the ground, the fingers facing forward, and then you lift the hips up, you walk just in. That's it. You have both hands underneath your shoulders, the armpits are facing forwards, and you have a straight back and rather a little bit too high with the back and a tucked in tailbone. And then you go down and have the elbows close to the rib cage. And you go down. And just the downward movement. You're hanging on the bar, and when you come suddenly up and you try to come as high up as you can. The front kick. Okay. Here up and out. A good standing leg, the other leg in front, and go down, not as with the one leg squat down, but the knee in front. But this is all at your own risk. You have the legs standing wide apart when you go halfway down the squat. So you have 135 degree here on the inside. So with this. You hang on such a bar, then you bring the legs long up, and again down, and again long up. Doing this is at your own risk. You have a ground. The hands are underneath the shoulders. Bring the legs out onto the toes. Your armpits are turned inward or rather forward. You have posterior pelvic tilt and your hip is rather too high and too low. On the ground, tabletop position. The hands underneath the shoulders and the knees underneath the hips. And then up with one arm and the opposite leg, and then pull them in to the side, the back, and to the side. Take the bar from behind, and you bring the legs up, then you pull. You take the bar from behind, then you hang, you bring the knees up, then you pull up. Okay. On the ground, and bring the legs up and down and again up. Don't arc with your back, keep lying on the floor. You put your hands underneath. It's important that you don't arc. If you arc, the back come up, make it a bit easier. You want to have your foot pointed or fixed. You're close to the floor. The heels can be up off the ground and when you come a bit up. Be warmed up if you do it, but it can be still strenuous for the knees, and doing this is at your own risk. You can hold it for quite some time. You start in runner's lunge, then you bring the back leg down, then you straighten the front leg, bend it down to the ground, and you try to keep the toes all on the ground, stretch that back, and you square the hips so that it goes back and the other one in front. Squared hips. Then you can bring the toes back and sit down. You can go back, down with the head. So squared hips, toes in, roll back and forward as a stretch. Make a lunge. When you come up, make a front kick. You stand straight up and you take monster step. Almost go to the floor, and with power from that leg, you come up again. Stand straight up, take a monstrous step, go almost down with that knee, and come with strength from that leg, again up. So you're doing this exercise on the floor. You're going into normal plank position, and the fingers are pointing forward, and you have the arms underneath the shoulders. The armpits are facing forward, you have a straight back and the tailbone tucked in. And when you go a little bit back, and then you hold the plank in this position. You have the legs over crossed, and take the hands back, and you come up, and you stretch up. You open the chest to the sky, and you stretch up. And then you come down again. You start this exercise on tabletop, and you place one hand in the middle, the other arm comes through, and then after some time, you can lift one arm up. And you can bring it also in front. The back, down and up. That's it. A bit tranquil version of the mountain climber. So, in push-up position, and then bring just the knees down. And try to stay completely stable with the hip and all the rest. Lying on the floor with a flat back, and the back stays all the time on the floor, never arc up. Hands behind the head, feet up, and one knee to the opposite elbow. Stretch out. And so. You're on the bar, and then you come up, and when you do a negative one up, hold up. Now you find yourself with that, then you come up. And you just slow it down. So you jump up and then you go slowly down. You can do it also with the lower bar. You have the feet standing around shoulder width wide apart. You breathe in and you breathe out, and one hand slides down one leg and the other shoulder stays down. So down comes up but it stays down. Then you breathe in again and you breathe out and you bring the arm over. Now you're going to breathe in again and open the rib cage. So breathe in then, and out again. Now you can add another cycle of breathing. You breathe in, and then out. And to the other side it looks like this. You breathe in, and out. One hand slides down, the other shoulder stays down. You breathe in, and out, and you take the arm over. You breathe in and open rib cage. And out again. Here you can add the optional cycle. And out and back into the middle. Take the bar from behind, chin grip, then you come up, and then keep hanging, just with one hand. No, sit there. You have such a bar, and when you hang, but just one arm, and as long as you can. And doing this is at your own risk. You stand good on one leg, the other leg a bit back, when you go down and up again. This can go under the knee, and doing this is at your own risk. You have a good and firm position with a standing leg. You bring the other leg up and out to the side. Hold it for around 5 seconds and bring it in again. And then down. And just repeat. Try to have a horizontal hip out to the side. And do as many repetitions as you want, but it don't have to be a lot. In and stop. You're standing good and stable. You lift both arms or fists in front up You bring them a little bit down and slowly up again. And the target of this exercise is a good movement of the scapulas. So concentrate on having a clean and good path of the scapulas. So the scapulas are providing a perfect socket for the arms and don't be so long or something. Concentrate on training the scapulas to move in a perfect path to give the arms perfect movement. And concentrate and slowly concentrate on the movement of the scapulas. So take the bar from the front, then you hang with extended arms, then you pull up and you go down again. You have the legs standing wide apart, more than shoulder wide apart, when you go down a few centimeters. That's it. You have a floor and something which is a bit higher. You can start with easier access by going that way onto the chair with one leg. Then you go up, and then you can just go just down. We warm up, and this can go on the knee, and doing this is in the arm. You're on the ground and you have your hands as support on the ground. And you bring your legs up, and now you can just rock them in, or you can do them as reverse crunches, even up. If the spine presses into the floor, you can lay a second of the toe under. You have one toe standing with the toes in front, the other one on the same line with the heels in front. When you lift the arms up, you breathe in, go with the hip back to the back standing. You breathe out, you shift in front, and you go down. You look up to that hand, then you breathe again in. And then out, you place one hand on the inside of the leg, the other one up. When you look up, that is the exercise. It all can be done way slow. When you breathe again in, come back, out, normal triangle, and back into the middle. That's it. You start in side plank. The top leg is further in front than the leg. And you sit the elbow against the other one and turn to the middle. And then to the other side. For 5 seconds and then back. The turn comes from the shoulders. Hold each position for 5 seconds. Neutral spine all the time and try to move the back and the hip as one unit. To the middle and to the other side. All as one unit and turn the shoulders. You can start from high plank and then you bring leg in front, soft lunge. You have the arms with one leg. You can open them. When you reach high with the upper hand, and you bring it back while you still reach. And when you still reach, bring it up. And in again. These push-ups are being done on the floor and on the knees. So I go in the front with a neutral position for the spine. Both arms exactly under the shoulders. And then you have long arms and you contract the triceps. And you bring the shoulders down. So don't have them up, bring them down, contract the triceps, neutral spine. And when you go down, but just with the scapulas, not with the arms. Try to keep completely straight arms. So contract the triceps, have the shoulders down, and go down only with scapulas. And then come up again. All the time slowly and concentrated, and only as long as you can do the good form. So neutral position with the spine, hands underneath the shoulders, blades, and the shoulders back as down, and contract the triceps, long arms, and only go down. With scapulas, slowly up again. You have such a bar when you hang, lift the knees up, straighten the legs, down, and again up. Doing this is sitting. You are sitting on the floor with the legs crossed. You have a straight back. You breathe in, and you breathe out, and you go a bit in front, and you open the chest to the sky. And you breathe in again, come into the middle, and you breathe out, and you go back, and you hollow the back. And you breathe in again into the middle, out again in front, and open the chest to the sky. Breathe in into the middle, out, back, hollow the back. You such a bar, you come up, and then you go down, just with the shoulders, so you sink with long arms, and just with the shoulders down, and then up again. Doing these exercises on your own. You hang at the pull-up bar, so you go up, just with the shoulders. You hang with long arms, you go up just with the shoulders. And then up just with the shoulders, then down. You have a bar like that, and you can take it from the outside, hang, and down. So you're on the ground, and you bring your lower leg out, a little bit more behind, and the other one in front of it. And the elbow underneath, shoulder rather a bit more to the body. And when you come up in a straight line, and hold it. When you're lying on the ground, you bring your legs in, go a bit to the side, and then down with the legs to the opposite side to which you have, or the hips to the side. Then the hands behind the head, and you come up. Full way, but a good way. The hands are not pulling on the head, they are just easy here to add weight, making it hard. Here up and out, side kicks. So you're on the ground and you bring your lowermost leg out in a straight line and your upper leg over it. Then you put your elbow underneath your shoulder, rather a bit closer to the body. Then you bring your knee in, your leg in from the lower leg, and put the other one on front. And when you can come up, and you have it all in a straight line, from here up to the middle of the knees. When you hold it for 10 seconds, 5 reps, is not really intent to train the core, but to help the quadratus above. You sit on the ground, legs a bit apart, point the toes, turn up, you bring the legs up from the ground. This exercise. Doing this is at your risk. The standing leg is firm, the other leg up, foot flexed, and now press with the hand beside or in an inclined angle against the knee. Try to stay tall, straight up, and try to have a hip in one line. You do this on the ground. You are in high plank. So the armpits are facing forward, the hands down. You have a tailbone tucked in and a straight back. And when you go slowly down, and you have the elbows beside the rib cage, and you go slowly down. And then you come slowly up again. You're on the ground and you have space. You bring your left leg out long and the right leg away. Then you come up onto your left arm with the arm underneath your shoulder. You have a good position, stable, and you bring your right hand out of the sky and bring it through. Up again and through and up. You are halfway down into squat, and when you turn and push to always to one side, and you turn only with the upper part of the body. You make a squat down and up and a side kick. Feet hip width apart, standing tall, and then gradually start to flex, contract the glute muscles, and turn the legs a little bit to the inside. Then take a deep breath in. To count the time, keep the glutes contracted and gradually release the glutes again. So you have one hand out, then you kick against it. Be warmed up before you do this. Hand out and kick against it. Hand out, kick against it, and the other one and against it, and the other one, and so on. You bring one leg to the side for normal position, then you bring it up for more or less pointed. Make a change. So foot up, and then you sit back, make one step, 2 and 3, and up, over, and 1, 2 and 3, over, 1, 2 and 3. On the ground, hand underneath the shoulder, the middle finger points forward, or the hand points forward, the knee underneath the hip, the feet can be however we want. Neutral pelvic position, a flat back, and the shoulders a little bit back, and press slightly in the ground, and this turns the arm eye slightly forward, flat back, and a little bit with the chin towards the chest. That's it. We have a stable stand. You lift the upper foot, flex the foot, and bring it in front and back, front and back. This puts stress on the knee, down in the hand, and that gets injured. This is the 90-90 position. This leg has 90 degrees and this leg has 90 degrees. 90 degrees and 90 degrees. 90 degrees because a full circle has 360 degrees. And that could be because a year has 365.24 days. That is the time the Earth needs to travel around the Sun. 360 is a manifold of 12. 30 times 12 is 360. 12 is a very good number. 10 is divisible apart from itself and 1 only by 2 and 5, whereas 12 is apart from itself and 1 divisible by 2, 3, 4 and 6. You can also count very good to 12. You can count to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 with the fingers, but you can also count to 12 with the phalanges. And if you have come to 12, you can count with the left hand how many times you have done this. And this way you can come very good up to 60. Whatever. A full circle has 360 degrees. 3/4 of a circle has 270 degrees. 2/4, 180 degrees. And 1/4, 90 degrees. So this is a quarter circle. Making this 90 degrees. 90 degrees and 90 degrees. And that makes this the 90 position. We have the more than shoulder width wide apart stable stand. Bow forward, the arms hang like fists, and now the scapulas up and together. During the whole exercise, pull the scapulas together. Now the arms of the elbows up and keep bringing the scapulas together. And hold it. And then down. Now take a rest, go back, or you can continue directly with another row. Scapulas together, up with the arms, hold for 10 seconds. Bring the scapulas together, elbows up, down, and next round. 4 or 5 rounds. On the ground, the legs straight up, flex the foot, and then to the tiptoes. If you can't make it to the tiptoes, or your spine presses into the floor, go not that high. You have the feet standing together, you breathe in, and you bring the arms up. And then you breathe out and one hand goes down. Now you breathe in and reach to both ends. And when you breathe out again, the arm comes up again. To the other side the same. You breathe in. You breathe out and one hand comes down. You breathe in and reach to both ends. And out and the arm comes up again. You sit and you toe up. We have the arms to the side. And then you turn them slowly to the front into pronation. Hold it and then you turn it back. And the exercise, and doing this is at your own risk. You have the feet standing an inch wide apart. You go down, and when you breathe in and you open one arm, and when you breathe out and lift it up to the sky, you can also bend your opposing leg. When you come in again, you breathe in, and out you lift the arm up, you bend your opposing leg, and so on this exercise. Standing on the floor, one leg up at a right angle, flex the foot, and stretch it out. The arms out to T, and bring the leg back, and then further back, and lean back. Bring it back, and the leg again in front. and back. The other leg, so leg up, stretch it out, flexed foot, arms out, back and behind. You can do as many repetitions and as slowly as you like. You have the feet standing around, hand width apart. When you go down and when you come back down, you should be warmed up before that. And when you come up high with the hands as you can, and also with the toes up. And when you come doing this is at your risk. You're kneeling on the ground and you bring one leg out to the side. The toes are pointing forward. And when you drive your leg into the ground, you are turned with the hips straight forward and you drive it a bit to the ground. You press a bit into that direction to the ground. Of course, not too much. No pain should be felt ever during this exercise. You have a stable stand, the arms up to the side, and you pull the shoulder blades together and to the outside. You make actively with force together to the outside. In. You can do this quite fast or a bit slower, but always with effort. So you're just standing comfortable, you bring the arms up, and when you reach up, and when you reach the other arm up, and you can pretend to reach for some apples on an apple tree to pluck them. And you do this exercise slowly and concentrated. It's more or less a relaxing exercise. Have a good stand on the ground and then out of the arms. And with a bend, look back and also move with the shoulder back. You can breathe out when you go back with the shoulder, turn but not turn with the hips. Feet a little more than shoulder width apart. Up the arms, breathe in and out to the side. Then in, arm again up, and out. On the other side. You start in a high plank. You have a strong core and tailbone tucked in. And you bring one knee in with pointed foot. And you bring it out to the side. Then you straighten the leg. And you in again. And back. You can do it all way slow. You're lying on the ground. You have a head long up. And you think of bringing your head further back. And you lift it slightly a centimeter off the ground. When you look down. But you don't come up something just a little bit above the ground. Try to come further back with the head and look a little bit in front. Hold it for 10-15 seconds and then again down. Doing this is at your own risk. You have such a bar when you start to aim, and you go back like that. Doing this is at your own risk. Now you're standing good and stable. You bring the palms together and then you press them a bit together and you bring them down, the fingers down, toward up. And you can do it quite slowly, a bit faster. Doing this is at your own risk. Sitting on the floor, the left leg straight ahead, foot flexed. Take the right leg, have it warmed up, the left hand to the outside of the right foot, and carefully stretch it and turn around. If it puts anywhere too much pressure, don't do it, especially if it causes pain, then don't do it. And slowly come back, take the right leg, put it down again. Again with the left leg, right head straight ahead, foot flexed, left leg in, right hand to the outside of the left foot, carefully stretch and turn around. On the ground, pull one leg in, left arm over, and have a straight back, then you turn around. And when you hold it, because in the spine, the vertebrae, it'll turn a bit when they are on top. So have a straight back. You are generally warmed up to do this exercise. You can start from tabletop into plank, and from plank into downward facing dog. With one leg up, and the leg went front, arms up. You put one hand on the outside of the knee, turn back with the other hand, and then you pull a little on the knee, and that is the exercise. When you come back again after quite some time, down again, swipe the leg back in the downward facing dog, and then you just end it. We have a firm stand on the one leg, and then put the other one out to the side. Not with your other leg. So you have a good and stable stand. You bring both hands up, and then you bend them at the knuckles, so here, and this is all straight. You hold it for 2-3 seconds, then you bring it up again and you're ready for swing around. You start in full lunge, and then you bring the elbows against the knee. Then you can open the arms. That is it. You bend the arm, and when we start on the inside, you flex the wrist to the inside of the wrist. You start here, and you start to extend the wrist, and you extend also the arm while you move up. And again, flex the wrist, and now extend the arm, and extend also the fingers. On the outside, just have your hand in, and we're going down, and you can also extend the hand and bring it a bit to the outside. Starting here, extending the arm, and the hands flare and a bit to the outside. And again, just down on different areas. So starting here, and here, then the top, and a bit on the inside, in different positions. With moderate pressure. Pain should not be involved. The feet a little more than shoulder width apart. The hands up, breathe in, and out, bring the hands down. Breathe in, open the chest, and out. You can add the knees. And open the chest, and out. When you're doing this exercise where you have one leg in and an up with a flexed foot and you're pulling it in, you can bring now the other leg up with a pointed or the flexed foot to variate the exercise. On the ground, legs arm out to X and up and back. Up with the elbows to the outside of the knees or into the middle. Into the middle or the outside. The feet are a little more than shoulder width apart, and you have a good stand. Then you come forward and have a neutral spine. And you let the arms hang, make fists, and lock them into the elbows, so the triceps gets activated. And then bring the shoulders back. Move only the shoulders. While you still try to go as far back as you can, you go in front as much as you can. And while you still try to go forward as much as you can, you go down. And while you still try to go as much as you can downwards, you go back. And after you've done this, you can change the direction. Not many circles, only 3, 4, 5, but good and concentrated. You have a good stand on the standing leg. The other leg up, flex the foot, and press the leg against your arm, and also upwards. And now change, pressing to the side and up, with the hands down below it. So to the side, up, to the side, up. And on and on and on. It's also with the other leg. You're sitting in easy pose with the legs crossed. You have a straight back and the shoulders are down, and you turn your head to the side. Very easy, only to have a little stretch, nothing great. And then after some time, change to the other side and go only a little bit to the side. Just a very easy and comfortable stretch. The feet are more than shoulder width apart. You have a stable stand. You breathe in, bring the arms up, and bring it in front, breathe out, and hollow the chest. And lower the head. Then you bring the arms, the head again up. Breathe in, open the chest, and breathe out, and let the arms down. Then repeat it. Breathe in, bring the arms up. Out, hollow the chest, head down, arms down. And in, breathe in, and out. You have your feet standing together. Then you breathe in and you lift the arms up. You overcross and intertwine the fingers. You reach high. You breathe out. You bring the arms in front. And you hollow the back. When you come up again, breathe in. And out. Have a good stand on the ground. Stand tall. Shoulders aligned and a bit back. Make fists and flex the fists. Both. And then bring them up. And turn them. And bring them down. And up. And turn them. All the time, keep the fist flexed. You've got a good and solid stance, and then you bring your arm in and flex your wrist. You bring it out and extend completely the elbow, the wrist, and the fingers. Hold it for around 5 seconds, and then bring it in again. If you want to strengthen the fingers individually, because they're weaker, you can press against the back of them. 5-6 repetitions. You've got a good and solid stance, and then you bring your arm in and flex your wrist. And then you bring it out, open the hand and the fingers, and fully extend the elbow and the wrist, and spread the fingers and pull them towards you. Extend completely. Hold it for around 5 seconds, and then bring it in again and up. Do this all for 5-6 times. If you want to strengthen individually your finger, you can press against the back of it. You're standing good and stable. One arm up and bring your hand behind the back. The other arm behind. Take the other hand and stand tall and carefully stretch. Round and have the legs in, placed behind the hips, the feet, and the weight is during the exercise on all parts of the feet equally. Most of it on the side equally. Then you come up. Start the lower part of the spine. And come up. The waist on the feet equally. In all parts. Then you can bring your hands together under the back. You can come up onto the shoulder blades. Bring the shoulder blades closer together. And you can pull your feet closer in. Take hold on the feet. And then you can come back down. Bring your hands out. Carefully the shoulder blades out. A bit more in front of the legs. And come slowly down, starting with the top of the spine. Then you can end, taking the knees, holding on a comfortable amount of time. You have a good, tall and straight up stand when you bring one hand in front of the chest to help you stay stable. And then you bring your head in front and back. The body does not move, just your head with your leg. You're sitting on the floor, you bring the legs out to the side, you pull the toes in, you're sitting straight up with the back, and then you lean in front with a straight back. And you hold it for 10-15 seconds, and then you lean in front with a round back. For again 10-15 seconds, and then you come up with a round back, and you're ready to repeat this exercise. So the legs are standing quite wide apart. You go down 3/4 squat, and when you place your hands on the knees, you breathe in, and out and you bring one shoulder in the front. And you breathe in, come back into the middle, and out, and you bring the other shoulder in front. You can also stay as a variation for a longer time in each of these positions with this exercise. You're sitting on the ground, and then you bring your legs in with the feet together. And you grab them slightly, sit tall, have a straight back the whole time during this exercise. You pull your belly a bit in and lean a bit forward. You can stay in this position for a long time. Nothing with pressure or force. It should be a relaxing exercise. Let's stretch your inner thighs, your hips and the lower back. The feet are somewhat shoulder width apart. The arms are up, and then one arm goes up and the other down, and the arm which is up goes in front and the other one behind. And then we go into a circling movement and keep doing this in a counterpart style. You have a good standing leg. Bring the other leg up, flex out, and then out, long out. Bring it again up and long out. You can take a hand here so that you don't kick yourself stepping back. And again out, and again in, and out. And that is exercise. You have a good stand, and when you bring one foot in front to the side and set it heel to heel. And then the other foot in front and heel to heel. After time, slowly you will find out your mobility and set them just back into the middle. You'll find out your mobility and know how to set them at this angle so you can set the other one comfortable against it and the back. If you like to do this, to music of your choice. So bring the foot in front and set it down. And the other one and down. And then just sit back. And again in front, and behind, front, back into the middle. Set your hand upon something and then go down, just with the shoulder. And then up. Don't do this until exhaustion. And be aware of the stress this puts on the wrist, the elbow, and especially the AC joint. And then prevent damaging oil. You're kneeling on the ground and you bring one leg out to the side, the toes are pointing forward, and you flex the foot, and your hips are pointing forward. Now you bring your toes up and back to the inside. You try to stay forward with the body. And that is the exercise. You have the feet standing together, the fingers interlaced behind the back. You have the shoulders back, strong core, then you turn the head to the side and you bring the chin to the clavicle. You can reach also down with your arms. That is it. So from tabletop position you're going into normal plank, and then you're lifting one leg up and the opposite arm. And then you just hold it. That is the exercise. You're warmed up and you start in runner's lunge. And you bring the back leg down, and you place both hands on the inside next to that leg. When you roll that leg into the side, then you can go down here, further down, but that's the exercise. You can have the feet standing together or shoulder wide apart. You breathe in, you slowly lift the arms. You close the hand and you breathe out. You allow the head stop. You stand stable and you're placing the fingertips of one hand on top of the fingernails of the other hand, and then you open that hand against the force of that hand. And when you close that hand again, with resistance against this hand. And you repeat this for a couple of times. You open against the force, and it is closed against its resistance. Feet a little more and shoulder width apart, and down. And then up, tiptoe and hands up, and again down, up and down, and up and down. The hands under the shoulders, one leg is exercise. Out to the side, foot flexed, and then straighten the leg for a couple of times. And try not to go down to the opposite shoulder, but try to stay in one line. The feet are more than shoulder width apart, and the hands are swinging front and meet also behind the back. You can clap, you can tap only with the fingertips, or tap not at all, or you can spread the fingers and try then to tap against the fingertips. As a yoga or stretching exercise, you can have one leg up, and then you change and stretch the other one up. You can do this with pointed feet or with flexed feet. When you have a good stance, put the arms out to the side with pointed and closed fingers and circle. If you've done it for quite some time, you can change the direction. You have such a bar, and you hang, and you come with the legs up, bring them over to the other side, and again, and over to the other side, and so on. This is what you want. On the ground, you might start a tabletop and go down in child pose. You bring your hands in, and you sit up, bring your arms up, and go down again into child pose. The idea of this is to keep down sitting on your legs. So not to go up, but to keep sitting. Lying on your back, one foot in the air, toes pointed, and circling. Consider changing the leg and direction of rotation. You have such a bar as an lower one. When you hang, you come up with the knees to the elbows, and again down, and the knees to the elbows, and again down. Doing this is at your elbows. So you bring one hand up flat, and when you make close, like that, and when you open again, and you close again, you hold it for a few seconds in that position with a little pressure, and you open slowly again, and you do it another time. Not too often, but that is the exercise. For this exercise, you intentionally use a sock or towel. You just hold it and you press on it with moderate force. You have a good standing leg and the other leg in the air, and you bring it in front and always in half or quarter circles to one side. You can do this also slower. Back, quarter, and over, in front. Try to reach the front to the side, and also with the other leg and so on. All in this case. You have a good and steady stance, and the arms to the side, and you bring the shoulder blades up and together, and then to the outside. So from down right to top left, down right, top left, and rather a little bit more behind the shoulder blades, and then up in front, coming up. So. You're sitting in easy pose with the legs crossed, and you have a straight back and the shoulders down. And when you bring the shoulders slowly up, you can hold them up, and then you lower them down again. That is all the exercise. This exercise is done seated. You have the soles of the feet together. You sit tall up. Then you put the hands against the inside, and you open the toes to the side. You sit tall up, and then you adjust it like that. You just have your hand, and then you try to come with one finger at a time over to the side, and then start again with the thumb and the other fingers over. That is all. Doing that is at your own risk. You have a firm stand on the standing leg. Bring the other leg up, flex the foot, hands in front, and turn the leg to the outside with the upper body in the other direction. If you have reached this end, try to go even further. A couple of seconds, back into the middle, and in the other direction, turn to the upper part of the body. Yeah, if you need to be. Back, and down, and do this also with your body. You've got a good stance with feet more than shoulder width apart. You've got a solid stance in the hips, but not in the force. You bring your arms up, and you go to the side. You can breathe out when you go to the side. And you try to relax all muscles upwards the hip. Don't stretch anything with force. After some time, you come back into the middle and go, breath out to the other side. You have a good and stable stand. When you have your arms next to you, hands form to fists. When you bring them up, so the thumb side is up, and then down, and you hold it in each of these two positions for 2 or 3 seconds, and then you change. You're sitting on the ground, you lean back onto your elbows, then you bring your legs to the side and to the other side, and you try to keep lying still with the core in one position. Side to the other side. Stand easy, the feet a bit more than shoulder width apart, the hand forward, go to line with the shoulders, and make a fist, and bring it forward, and then press moderately or softly onto the side, onto the top, for a couple of seconds, for around 10 seconds. The other side, and the other side. This puts, of course, pressure onto the wrist. So if you have an injury on the wrist, mark it worse, so don't do it if you have an injury or don't know exactly what you're doing. And this is overall stressful exercise for the wrist. So take care not to injure anything. The feet a little more shoulder width apart, the hands up and behind. Chest opens to the top, and shoulder blades together and the elbows behind. When the hands come up, you breathe in, when they come down, out. You have a stable standing leg, you take the other one at the ankle, you bring it back, you have a neutral position with the spine, so that you actually stretch the quad muscles when you hold it for 10 or 20 seconds. You have a chair to stand more stable, and then you stand on one leg, and when you come up onto tiptoes, and try to go to the big toe with weight, up and down again. Then again up, and try to come to the big toe with weight, and down again. Doing this is at your own risk. So you're good and stable standing, and when you bring one arm with a tennis ball or something, and when you turn it in that position. That's the exercise. Have a good stand on the ground, arm with a fist out to the side, and a bit in front. Then external rotate the arm, and make an anterior tilt of the scapula in the front, and hold it for a few seconds. Then internal rotate the arm and go into posterior tilt with scapula, so back, and hold it again. And then change a couple of times. External rotate the arm and anterior tilt with scapula. Try to keep the shoulder down. And internal rotate the arm and posterior tilt the scapula. You're on the ground and you have room. Then you bring your first leg out and your second leg on top and go up with the arm underneath the shoulder. And you bring your arm on and your leg up, and then you bring the elbow and the knee together. And you do this as long as you can hold it without falling down. You start this exercise from downward facing dog. When you come into the stretching dog, then you pull the knees in and you go also with the tongue closer to the knees. That's it. So this is done lying on the floor, and you take one leg at the ankle, then you take the other one at the ankle, then you just lie down and stretch. That's it. You have a good and still stand, Arms in front, and you bring them up and back together. Up, back together. That's all. You have a good and stable stand, both and shoulders apart. You bring the arm against the head, and you first press lightly, then more, then with good power, and then gradually less. Go front, more, and slowly less. Go back, more, and less. Then from the side, and turn to that side, but don't actually do it because the hand resists. And then the other side, turn to that side, but don't actually do it. And then down. On the ground, up with your legs, foot flexed, and then always one foot first and the other after. You can have your hands underneath the buttocks, but keep lying on the floor with a straight back and down arch. Now you go into high plank, arms underneath the shoulders and a straight back, and then you just shift in front. And then again back. Lying with the back on the ground, and bring the legs in, and then turn the head over to one side. And that's all. You're lying with the front on the ground, and then you come up the arms and the upper part of the body. You draw the shoulder blades together, and you try to do absolute no muscle work with the lower part of the body. And then down. Bring one leg in, pull the heel of the foot towards you, and bring the foot into external rotation. And then bring the leg up while keeping this external rotation. Upwards and downwards again, and pull the heel towards you. Then change into internal rotation of the foot and bring it up while keeping this internal rotation and down again. And change again, up, down, and so on also with the other leg. So you have such a bar when you you're on the floor, you take one leg in and pull it to you, point the foot, and you bring it out, flex the foot, stretch upwards, then again in, pull it in, pointed foot, and change again, upwards, flex foot, and in, pointed foot. This exercise is done on the ground. You're on tabletop, one arm out and the opposite leg out, and then the arm to the side and the leg to the side with flexed foot there. And that's the exercise, but if you do it, then it's at your own risk. On the ground, hands underneath the shoulders, and flat back, slightly tuck with the chin, and try to keep the elbows straight in the other direction. Standing, and you have a stick. When you want to train your right arm, so you take it with the right arm at the top from the bottom and go with the thumb on top. The other arm a bit more lower. When you go down, and look if you have enough space there. And when you come up, always with the thumb on top and look if you have enough space there. And that is then basically the exercise. So you bring it up, and the supporting hand, this one, helps the other hand to come up. And again down and up. Look that you have enough space, and doing this is at your own risk. We've got the stable standing leg. We get our one up, foot flexed, hands in front, and turn to the side. Only with the hands, the arms, and the upper part of the body. The knees just pointing forward. Slowly and concentrate side to side. You have the legs standing around shoulder wide apart, and when you breathe in, you bring one arm up, and you breathe out, you bring the arm to the other side. You can also slide down the back for that. Or you can just back. You have the legs standing wide apart. You have the arms up to a T, When you bend forward with a straight back, you go down. Arms staying at the side, you make a round back and go down. Then you straighten the back up again and lift the head first with straight back up again. On the ground, in the high plank position, and then up into the downward facing dog, and back into high plank. And again back into the downward facing dog, and again back into high plank. You're standing, have both feet together, and then you tap with the big toe onto the floor and sit down again. And tap again with the big toe and the pointed foot onto the floor. Pointed foot and tap with the big toe on the floor. So most of the times you have your feet standing together, then you have your arms for some reason up. You breathe in, when you breathe out and you go down this way. So you have both arms together, when you bring them to the outside where you lower the back, go down and you end down with both arms down and also the head. Like this sit. You have a bit space between the feet, and you breathe in, lift the arms up. You breathe out, open to the side, and then in, and you come up onto tiptoes. When you breathe out, you go down, but you stay on tiptoes. You breathe in and come halfway up, high up, and you breathe out and come up again. Breathe again in, reach high and out. Step again down, out to the side. Again in and up. Out over the sides down, all on tiptoes. In halfway up. Higher up. Out and down, all on tiptoes. Breathe in, reach high. And then out and down. Be warmed up, and doing this is the always. You have the feet standing shoulder width wide apart. You intertwine over across the arms. When you stretch from the front, you hollow the back and you breathe out. That is it. Sitting on a chair, straight back, bring one arm up and then down to the other side. Further down. And you should feel already stretching. Now you go more forward, arch your back a little bit, go more forward. Also the shoulder more forward. Now take the arm, bring it even more into that direction. And this should stretch quite good. You're lying on the floor, you have the legs in, and then you tuck the tailbone in, you come up to the bridge, then you lift the arms up, then you breathe in, you open the arms to the side, and out again up, and then in and back, and out. Then you can repeat it in and out, and ever so on. You have the feet standing together, then you breathe in and you lift the arms up. And when you breathe out and you bring them down again. This exercise is intended to do it for multiple repetitions, and you can do it very slowly and under concentration as a meditative exercise. You're on the ground and you have one leg up and you tap the floor, you bring it up to the outside and tap again, and that is the exercise is just repeated. Tapping in, up, out and tap, and that's all. You have a stable stance, bring one arm up and with the other arm beside your elbow and push it a little in. Have a shoulder down, bow. And then hold this stretch for 30 seconds and then continue with the other arm. You have the legs then wide apart and you're going down into half squat and you're pressing the hands against the inside of the knee and you're going to the knee. Then on the other side, you press against the knee when you go against the knee. You have a bit more than shoulder width wide apart stance, and then you bring your arms up and down again. And you can do this also front and to the side. Don't do this with force behind, just gentle and controlled. And also up to an X. Again, not for force. With one hand, you make a loose fist, and you bring the hand a bit down into flexion, and then to the inside, the radial deviation, Then you take one hand and you support the index finger with the third finger on top, down to the inside, and then press. Are you pressing onto here? And then move over a bit. Press onto the ECU tendon and go over it. Press onto it and go over it. But be careful with this exercise at your own risk. You're comfortable standing when you have the hands up, and now you open them slowly and slowly you close them again. You don't have to extend the force or flex the force. You can just open and slowly close again. And again open and then again close. You have the hands in extension with spread fingers out, and when you pull always the thumbs and the index fingers and the middle fingers, the ring fingers and the pinky fingers towards you, but also the other joint, bring them in front, one by one. So like that. Doing this is at your own risk. You have the feet standing a bit more shoulder wide apart when you breathe in and out your shoulder down. You put the hands on the ground, you bend the knees, straighten up, and you come up. Again. The fingers intertwined, the feet around shoulder width apart, but they can also be closed. Hands up, breathe in and out to the side. In, up, and out to the other side. Feet a bit more than shoulder width apart, and then stretch up and not to the side, but up into the corner. For around half a minute, and then change and up into the corner. This exercise is a big arm circle, far back with the arms, but while you do that, you have the hands top the fists, and you circle the wrists. Far back, and then you can also change the direction. One leg is standing good, the other leg a bit out, and then lift the leg in a straight line. The foot can be pointed or flexed. Hands can be wherever they want to be. You go down and have a straight back, and then you put one leg out and put it again in, and you're on the knees also. Out and in. You have a comfortable position with the feet. You have the arm with the fist beside you. You have good aligned shoulders and a comfortable feeling in the arm. Then you turn the fist in and out. You slowly turn in as far as it goes without too much effort. With a little effort in, hold it for a slow moment, and then slowly turn around and go into the other direction as far as it goes, and hold it there shortly, and change slowly the direction again. You have a good and stable stand, then you have your arms next to you with the hands front to fists, and then you bring them down, you hold it for 2-3 seconds, and then up, you hold it again for 2-3 seconds, down, and holding, and again up, and just so. You have a good stance on the standing leg. Bring the other one in front and point the foot. And you bring it on the outside around. Now you flex the foot and sweep it through. And you repeat this motion. You're on the ground, and then you bring one leg out and back. You can have the foot neutral or rather flexed. You bring it more or less into the middle or just back, or also up into a straight line. This and repeat it. At some time maybe also with the other leg, as many as you like. You have a more than shoulder width wide apart stand. Then you bring the arms together, the elbows together, and stand straight, and bring them up as high as you can under pressure. And this trains a lot of muscles. You have such a bar, you hang, then you bring the legs up, and again down, and again legs up, and down. Doing this is a down. You have a good and proper stand, You have both arms with long fingers next to you. Then you bring these arms slowly up, and you actively think about bringing the scapula into the right position so that the arm can come good up. So don't have a shoulder or the scapula in front, but that the scapula perfectly goes into position, the arm can go perfectly upwards. So you lift them slowly up, and you are actively thinking about the scapulas and the shoulders so the arms can come perfectly up. You bring one knee up, bring it to the outside, and bring it in. And the other one up to the outside, up and in. And you repeat it. Up to the outside, up and in, up to the outside, up and in. This exercise works like this. You have a stable and good and comfortable stand. Then you bring both hands up. And you bring the hands down into flexion, and you flare all the fingers. Then you bring the hands up and you make a fist, a strong fist. You bring the hands into extension and you also press the fist together, the hands together. And then you change again. You go down into flexion with the hands and you flare again all the fingers. Then you go up again, make fist again. And you press this fist strong together, not overly much, press them together and up again. And then you repeat this for a couple of times, not too much. Again, down, flare the fingers, and up, make fists and strong fists. On the ground, the hands over cross, fingers turned to that direction, straight back, and then arch with the back. And the next round, the other way around, your hands. For a couple rounds, hold it for around 20 seconds each round, 4 or 5 rounds. You have a good and stable stance. When you have a dumbbell or something like that, you have it with the fingers upwards, so to the thumb side and to the outside with the greater lever. And then you lift it up in a straight line, and you move it slowly over, again back and down. So, up, over, back, and down. And this should not cause pain, and down over it. You put the heel of the leg onto the ground, and then you turn your leg to the right and to the left. The whole time are you pulling the toes in. That is the exercise. You have your feet standing around, shoulders wide apart. You breathe in and out. You draw the head down. You go down. With the hands into the floor. And you bend the knees and you go down. And you straighten the legs in. And you come back up again. Have the lower body warmed up, especially the knees. The legs a bit more than shoulder apart, the feet pointing outwards. Have a neutral pelvic tilt, rather a bit posterior. So in front of the pelvic. Bring the hands in and go slowly in a straight line down, the abs, the core muscles engaged. Then put the elbows to the inside of the knees and press gentle against them. You want to come back up, you can put your hands down and come back up with a round back and a shoulder. Or you can also, with strength from the abs and the core, come back up in a complete straight line. You've got the good standing leg, the other one goes up and then points and flexes, points, flexes, and you have both hands formed to fists. Then you flex them a little, and then you bring the fists up to the side, down to the outside, and up. And when you change the direction, you go slowly, while you press, make strong fists all the time, over and up. By this exercise, when it happens that you are in lunge, by yoga exercises, you can have your arms up, and when you turn them, the other way around, or like that. So, like that. That's it. You make a Crescent kick, go to the side and a side lunge. And you come up, make a Crescent kick over to the other side. Repeat it a couple of times. So you're standing, when you turn sideways, hold the weight onto one leg and go behind onto the other leg, partially move away, and again in front. And then you just rock. You can also set the heel completely down. And you do as many as you want, but consider doing it also on the other side. On the ground in high plank position, bring one leg in, go it back to make it a right angle if it wasn't, and come up and stretch your arms out to the top and go back down. Leg back, the other one in, make a right angle if you could manage it, and bring your arms up and down and repeat this. You have a stable stand. You flex your foot, bring it out to the side, and then swing it in front as if you were kicking a football. And you just swing it. And the foot keeps flexed. And mind that this puts stress on the knee, so that you influence it. Lay your arm onto something, this can be your leg, and then you go a bit pinching over the whole arm, and go half over back to the shoulders, and back again. Do it a couple of times, all at your own risk. You bring the hand up, make a fist, bring your hands a bit down and to you, so radial deviation, and then you go with the thumb over the extensor capillaris tendon a couple of times. Completely at your own risk. Up with the leg to the side and down. Up with the leg to the side and down. And again, up and down, up and down, up, down, up and down. Also to the other side, up and down, up, down, up, down, up, and down. After you've done some type of exercise and you want to bring the leg again down, you can make it by bringing it up with a pointed foot. Take it a bit like that, and then slowly bringing it down. Bring it down. That way. So you're on the ground and bring one leg and stretch it out and flex the foot. You can pull it a little bit if you want. You can now bring the other leg partial or completely down to intensify the stretch. After some time, you can point the foot and then flex it again. And you can also lie down while standing. And if you're done, you just bring your leg. Standing while you have a towel, and then you try to pull the towel towards you with the toes. You can do this also barefoot, it should be easier. But doing this is at your own risk. You have a good standing leg. You bring the other leg up, you pull it high, you point the foot, hold it for 1-2 seconds, and you bring it up, and then again down. Up, you can interchange this a couple of times, so always down and up and holding it for 1-2 seconds. On the ground, one leg out to the side and the toes pointing forward. On the other side, maybe something to make it a bit higher, and then lean over and stretch with the right side. You just stand good and stable, and then you circle your lower arms around quite slowly. If you do this, then it's at your own risk. You're on the floor, you bring one leg out with a bend in the knee and a flexed foot, and then you bring it up and beat. And that is the whole exercise. You have a good and stable stance, and you have something light-weighted, a dumbbell or so, and you lift it up like that, the heavy end to the thumb side. You have a neutral position in the wrist when you lift it up. When you bring it to the outside, again to the inside, all slowly, and then down again. So you bring it up, neutral position in the wrist, slowly over, and again in, and this should not cause pain. Also don't overdo it. If you have a good standing leg, you lift the other leg up into a right angle with a flexed foot. The hips are even aligned and you are tall up. And you press with a hand against the outside of the leg. Then you open that leg against the pressure of the head. And you close again. And then down. So you're on the floor and you bring one leg out, and when you bend the knee and out, you get in and you have a flexed foot. That is the exercise. When you're standing, bring one foot with a pointed foot up and the knees turned to the outside, then down again, and the other one up with a pointed foot. So repeat this as long as you're willing to. A little more than shoulder wide apart stance. One arm up and with hand behind the back, straight back, try to stay as tall as you can. With the other hand, take the elbow and stretch gently triceps down. Not too long, half a minute or something. You have the feet standing together or with an inch wide space between. Then you breathe in and you lift the arms up. And you breathe out and you go to one side. When you breathe in again, you come to the middle. And you breathe out and you're going down into the half chair. Then you breathe in and come up again. And out you go to the other side. You breathe in, come back up. And out and you can go also down into full chair. Up again. And just so. You have a stable stand on the standing leg. Then you bring your leg out and the arms are to the side. And take your leg in and round the back. And again out and straighten the back. You breathe in and out. Then you repeat it. So you're on the floor, then you lie down and bring the lower leg long out and the upper one over. You stretch your arm long out and try to bring the shoulder down and breathe deep in into the chest. When you breathe out, you try to go a little bit further with the arm and a little more down with the shoulder and breathe in. You start this exercise on the floor in tabletop position. You bring one leg out to the side, the toes are pointing forward, and you go quite far in front with the hands, and you go down while you press your hands into the floor. And there's the exercise, and there you hold it. The pain should not be involved. On the ground, when you straighten the arms, you're still with the pelvic on the floor, but the rest is up. Doing this is at your own risk. You put the heel of the foot onto the ground and you pull the toes in. Then you bring your foot to the right and you pull still up. Then you put your foot to the left and you pull still up. Then you put your foot again into the middle and you pull up. And then you turn your whole leg left to right. And that is a stretch. So this stretch, just the heel onto the ground. And now to make it properly, you pull the toes up. Now you can go to the side and pull still up, and to the other side and pull still. So the variation is to go to the side and pull up. Not to the other side, so that side, and pull. You're on the ground and tiptoes, and you go in front and back. Again, we do it also backwards. The hands first. Nothing. We warmed up, and doing this is at your own risk, and I can go onto the knees. You have a good standing leg. You bring the other leg up with a flexed foot and then out. You can hold your hand here so that you don't accidentally kick yourself, and you can do it wide upwards or even more downwards, like that, also like that, or 6. So you basically just do normal steps, but you always make a little jump in between and then one leg comes up. And then you absolutely straight and straight. On the ground, hands underneath the shoulders, maybe a little bit turned to the outside, the armpits turned forward, up with the back, shoulder blades down. Now the knees slightly above the floor and the posterior pelvic tilt. You are in semi or full squat. Your arms are behind the head, and when you go down to the side, back into the middle, and to the other side, it continues. You try to stay as tall and as straight with the back as you can. You have the feet standing together. When you breathe in, you lift the arms up. And you still reach in and you reach with the fingertips higher. And out. Again down. You have a good stable stand. Then you bring one hand up and you bend it at the knuckles. When you press one by one a little onto the fingers. On the next one, and on the next one. For a few seconds, and on the next one. That's the exercise. Now you stand good. Then you bring one leg up. And when you other one, and always be opposing arm out. So, like that. Doing this is at the arm. With the feet standing a bit more than shoulders wide apart. When you sink down to squat basically. When you're down in squat, you bend forward. Come back up. And come with a round back again. You go into 1990 lunge. And then you are torn up with the back. And you pull at the leg. You pull it up. It's an isometric exercise with quite a lot of effort. The standing leg is stable. With your other leg, you do something which will look from here like an 8. If you want, you can bring your hands up as a stabilizer. You have a good and stable stand and something light-weighted, like a dumbbell. When you take your arm at the elbow, close to you, and when you bring the weight to one side down, to the supination side, and again into the middle. So slowly to the outside, and back into the middle. This should not cause pain, and also do not too many of them. You're on the ground, and you have your feet close, and hips apart, hands down, and when you start to lift, up, and that's bridge pose. But now before we do it, we cross one leg over the other. Try to keep the knee to the outside, and then we go. Starting at the end of the spine. And we try to not to fall down with it up. So, that knee to the outside, but that hip not down, but up. And then stretch the leg and point the foot. And again, try not to fall down, but up. When you have enough, bring the leg down, and lower down, starting at the top of the spine. And that's it. You make a straight back, and you flex the gluteus maximus, lift the arms up, and you press the shoulder blades together. Open a bit the chest, and then you carry it easy. You stand good and stable, and then you try to come up with the 4 toes, and then the big one, the 4 toes, and the big one, the 4 toes, and the big one. Try to do it, and doing this exercise is at your own risk. You have such a sidebar, you go onto it, you go that's all. So you start in tabletop position, you bring one arm into the middle, you bring the other one through, you lie down onto the shoulder, and you lift one arm. Then you breathe in, and out you bring the hand behind the back. You breathe in the arm again up, and out and in front. Again in, out and back, again in, out and in front. Bit of core, slowly and concentrated, but that is exercise. Sitting on the floor, legs straight ahead, arms up, down, and the left hand to the outside of the right foot, and up. Don't do anything with too much pressure or force. You want to prevent damaging your tissue. And back. Again up. And the other side. Down. And up. You're on the floor, you bring your legs up in the right angle. The arms out to the side, to the out. Then go down with the legs to one side. And to the other. But don't lay them down. But you can lay down the head. So you're on the ground on the side, and the lower leg tries to go as far behind as it can. That's the first part of the exercise, and you can just do that. And then you put the upper leg against the knee, the heel of that leg against the knee of that leg. Now you press that leg with the knee into the heel. And that's the exercise. You're sitting on the ground and you have one leg out and the other one in. When you come tall up and you go in front and you pull a little bit at the toes and you don't go to the outside but more to the inside. And when you stretch, you can lean a bit in front and you are stretching the leg. You're on the ground and have the legs in, and you bring one a little bit to the outside and up. And now turn a few more big down in this leg to the inside and the ankle to the outside. So like this. And hold it for one slow breath. Then put it down. The other leg on top. And now push with the knee into the ankle. Into the foot. Also for one breath. And then the other side. You go for a thumb with moderate force or even slight force over these muscles. This can cause irritation at the roots of the hairs, so keep it in mind and hold your arms. You have your feet standing together. When you breathe in, lift the arms up. Breathe out, lean with long arms back. Then you draw the arms in. Lift the shoulder blades together. And in up and down. Doing this is at your own risk. You have your legs standing a bit more, the shoulders wide apart. And when you press to the outside, so you try to come to the outside. That is all, but if you do it, then it's at your own risk. So you have one leg standing like that with the toes forward, the other one with the toes to the side. The heels are standing on one line. You lift the arms up to a T, you breathe in. And you breathe out and you shift out of body weight over to one side, and you also make your hip no longer horizontal. And you breathe out, and you go down. Take hold on the front leg. And then you can take your arm over. Let's then stretch in the exercise. On the ground in child's pose. And then you bring one arm a little to the side, cover it up, then go back down and try to keep that hand there. And go down and stretch the dismus down for around 20 seconds. This variation of the exercise, you're lying on the back, and when you have the other leg in with the pointed foot, you can then decide to bring the other leg also up with the pointed foot a bit. That's it. You have a comfortable standing position, the arm at the side, good aligned shoulders, a comfortable feeling in the arm, with a flat hand, the palm faces to the floor, and you turn the fingers to the inside and to the outside. Slowly turn to the inside as far as it goes good, with a little effort into the outside, and at the end points you hold it for a little moment and you slowly turn around into the other direction. You go as far as it goes good, hold it for a little moment, and slowly turn around and come into the other direction. You have a good and stable stance, and you have a dumbbell or something like that, then you take your arm at the elbow, close to you, and when you lower your weight down on one side, go slowly over to the other side and lower it again. You do it for a couple of times. This should not cause pain, and don't do it too often. You go into 90 or 135 degree lunge, and then you are tall up with the back and you pull at the knee. So by this exercise you have the legs standing wide apart. When you go over to one leg, then to the other one. You have the toes pointing more or less in front always. So in front, the other side, other side, other side. You have the feet standing together or shoulders wide apart, and you breathe in, you lift the arms up. Then you breathe out, bring the arms back and you open the chest to the sky. And you breathe in, you bring the arms again up. Now you overcross and intertwine the fingers. You reach right up, and you breathe out, you bring the arms in front, and you hold over back. Then you breathe in again, bring the arms up, out again, back, out the chest. In, intertwine again, overcross. Reach high, breathe out, come to the front, hold over back. And that is it. You are previously warmed up, and you have the feet standing together. You go down, and when you breathe in and out and you stretch only one leg, and you breathe in and stretch both legs at the same time, and then out and bend the other one. And when you cycle this, you breathe in, both back and out, one in front, and it's more or less a circle. The toes are pointing to the outside. Have an unlimited space between the heels. Breathe in and lift the arms up. And breathe out and sink down. Place the elbows against the inside of the knees. And breathe in and straighten up the back. Now breathe out and come with the crown of the head first up. Tuck the pelvis in. Up in one straight line. Breathe out, the arms down. And breathe again in. Hands up and out, and you can sink down again. Again, breathe in, straighten up the back. And breathe out, tuck the pelvis in, come with the crown of the head first, slowly up. And you can go to another round where you just bring hands. Sitting on the ground in cross-leg position, straight back, palms of the hands together, and turn the straight back to the side. Look over the fingertips. And turn back, breathe in and out to the other side. This is then lying on the floor. You bring one leg up, you take it at the ankle, and then you stretch down. And that's it. You're lying on the back, and then you bring one leg in, and you have both feet pointed, when you make some circles with the knee. That's all. Have a good stand, the arms with fists to the side, and supinate the arms and the biceps. And now keep the biceps in position, but pronate the arm. So don't turn with the biceps, but keep the biceps in position. Supinate, biceps flex and in position. And now pronate, but keep the biceps in position. And then hold it. And press against biceps. Let's squeeze biceps. And now the other way. Pronate completely with the biceps, and now supinate the lower arm, but keep the biceps in position. And pronate the force. Of course, not too much. And then keep it for quite some time. The feet are together, and then the weight comes forward, and then back to the heel. The toes can lift a bit, or not a bit. And then again, front, maybe even up to the toes, and again a bit back. And so. So you're lying with the front on the floor. You have two objects in front of you, a bit more than shoulder width wide apart. Bring both hands to the outside with the thumb pointing to the sky. And then you lift the arms up, straight arms, over these objects. And you try not to come up with the chest on the floor. Slowly and concentrated this exercise.
There's such class when you start, and when you open one side, you have such a side plan, and then you take one, and then you skip one, and go to the next one, and go over, two next one, to the next one. You have such a bar, but when you take it from the side, you hang on it, and then you go to the side. Like that, that's it. Irgendwas ist ja der auch nicht.
So you are basically in high plank position, and when you bring one feet in, and bring it to the elbow in front. And you change, and you do it on the other side. You can do it a bit faster, or also meditative and very slow. This exercise is done on the ground. You can start from the downward facing dog or from the high plank. Now when you start from the downward facing dog, like that, then you come up onto tiptoes, then you come up and make a long plank, and you go in front to high plank. Or you can start here in high plank, and you bring your back round up, back, up onto tiptoes, and down. So you're on the ground, like mountain climber, but then you make one fast switch. This is the exercise. Doing this is the always You stand stable on the one leg, you bring the other one up, you pull it high, you relax the leg and you point the foot and you hold it for 10 to 20 seconds. Feet more than shoulder width apart and then down. Down into the middle and straight. Then maybe to the left leg, maybe to the right, back into the middle, and come back up. Maybe with a round back, and the shoulder round backwards in the final stage. You sit in easy pose on the floor, come tall up with the back, you press with your hands into the ground, shoulders are down, tall up with the spine, then you breathe in, and out, chin down. And in again. Doing this exercise is at your own risk. You have the feet standing around hip width apart. When you go down a bit into the knees and you flex the gluteus maximus. And when you straighten one leg, keep the flexing of the gluteus maximus, hold it a bit, and again down. Flex the gluteus maximus and straighten the other leg, think on flexing, and straighten the bend it again, and come up. Doing this is at your own risk. From warrior 2, one leg in the front, and the back leg with the toes pointing the other side, and the arms up. Then you bring one hand back, and turn the palm up to the sky. You breathe and you reach in front, and you go back, you slide with the hand down the leg, and you look up to the other hand. And then you can bring the head down to the foot, and the chin to the clavicle. Then you can breathe in, straighten the front leg, reach further back, and also down, and out, lean again in front. And then you come just back. You have just a stable stand, and your arms up with the palms facing upwards, and you bring them more or less together and up again. And you just repeat it for a couple of times, it's all. With quite a wide width as a stand, and then you push to the side and go down with the knee. And then you change, go down with the knee, and push to the side. And keep repeating this as long as you know. You sit in easy pose, tall up, with hands onto the ground, and you breathe in, and out the chin down on the chest. Again in, out turn the head over to the other side, to one side. Now press with the hand into the ground, where the head is turned to, and the other one and stay. And you can turn over to the other side. Press again with the hand into the ground, where the head is turned to, and then the other one. Doing this is at your own risk. On the ground, in little high cobra, and then you move your head to the side slowly, and to the other side also, and bring the middle in between. Doing this is at your own risk. You have the feet standing almost together, maybe an inch space between them, and then you just go in front, and just again back into the middle. So you just go in front with the balls of the feet, keep standing there a little, and then again back. That's the exercise. This variation of a downward facing dog happens if you are in a downward facing dog, have one leg up, then you can flex a foot, bring a leg for something like that. You have the feet standing together, when you pull the toes in and down again. Pull in and down. You can also take balance on the side. So you just pull the toes in and down. You have a stable stand, and the arms to the side, and you bring the shoulders up and down. Up and down. Most movement happens with the scapulas. Do the effort up and also down with effort.
You have such a bar, and you hang and you come up with the knees, then you make a pull up, and then break up the knees. So up and pull up, and with the knees, and pull up, and so on. Doing this is a
Be a little warmed up for this exercise and don't overdo it. Do it careful. You have the legs standing your shoulder wide apart, you go down. You hold a bit onto the legs and you go a bit down. This is mostly a leg stretch, not a back stretch. And you can help a little bit with the hands to go down, but do it all carefully and at your own risk. The feet are together or open, but they are stable. The arms out to the side and swing them. You have the feet standing together when you bring the leg in front and tap with the forward part of the foot and the second time just with the big toe. Then you bring the leg to the outside and tap the forward part of the big toe, so the flat and the flat part. And the second time just with the big toe. And then back just the half foot, and then the second time only with the big toe. And back into the middle, and the half foot, and the big toe, back into the middle, half foot, big toe, and into the middle. You have the feet standing a bit more than shoulder width wide apart. You breathe in and bring your arms up. And then you breathe out and go down to one side. And the next time you breathe in into the chest and open the rib cage. And then you breathe out again. And then you can add another breath cycle. You breathe in and out, and then back into the middle, and then the same on the other side. You stand tall and straight up, and then you press a little bit against the jaw, and you relax the jaw. When you press the jaw a bit in front, and then you relax the jaw again, but you keep a little pressure. Then you can repeat it 1 or 2 times, all carefully, all at your own risk. Sitting on the floor, legs straight ahead, back straight, and slightly leaning back. And the arms to the side, and the right hand to the left hand, and slowly back, and with the left hand to the right hand. Slowly back, and again, and the left hand to the right, and back. So you're standing, the feet can be closed. You lift the arms up and breathe in. And when you breathe out and you go to one side, then you breathe again in and you open the rib cage. And out back into the middle. Then you breathe in again. And out you go to the other side. You open the rib cage while you breathe in again. And out into the middle. And when you breathe out, you go in the front, but you don't pull the head down, just when it comes to the down. Then you breathe in, come into the middle, and out you lean back, and you open the chest to the sky. And you breathe in, you come again back. It's an exercise, but of course, in a line with the breathing. You stand nice and easy, and you have your arm at the side, go to line shoulders, and a comfortable feeling in the arm. And then you flip your hand to the sky, and slowly flip it again down to the bottom, and you slowly keep changing this position. You go as far as it goes, and when you reach the end, you hold it for a little moment, you slowly turn around and go again into the other direction. With a little effort, as far as you can go, hold it and slowly turn around into the other direction. So you're in the best position, and you got room to walk in front. And you go in front, 1, 2, 3, and 3 back. If you go now again, 3, changing always the arm with which you start. First you have a good stand on the ground, and you open the chest and hollow it by bringing the arms in front. Open the chest and bring the arms in front and hollow the chest. You breathe in, you open the chest, and out when you hollow it. The next standing a bit good wide apart, go down into the knees and flex the muscles of the upper legs and also press with the legs together. And now go over to one side, keep the pressing together the whole time. Stay a bit, press both them together, try to flex the muscles, and over to the other side, press together, flex the muscles, back into the middle. That's the exercise if you do it as well as the opposite. So it can happen that you come across being basically in runner's lunge, and you have one hand in, and you're up to the hand like that, and you can breathe in, and out you can bring the hand down. And you can breathe in, and out, and you can bring the hand in front. Bring it in, and out. Basically just this little variation. You have the feet standing together, then you bring the arms up, you breathe in, and you breathe out, we circle the arms far back behind, bring them in front, close the fingers, and sink down into the chair. So this exercise can be done. You can have the feet standing together, or a little space between them. And when you're down, the hands on the ground, you can be also completely down. And when you breathe in, and you go down, and you breathe out and you come up again. That can you repeat for a couple of times with this exercise. So you lean a bit forward, let the arm hang, and swing it. You can change the direction. Now the arm. Both feet are together, and then down to the floor and up to one side. You're standing firm, the two arms go behind, and when the pulses even more behind, or also to the inside, whatever you want, however long you want. You go into full lunge, when you pull the tummy in and put the chest out, and you bend over and you pull at the leg. You're lying with the back on the floor when you bring one leg in with a pointed foot, and when you breathe in and out and you stretch it up, and again in and bring it down again. Again out and leg out, and in, leg in. That's the exercise.
So you do all this for 1, 2, 3, 4, then one leg up, 1, 2, 3, 4, 1, 2, 3, 4. That's it. You go carefully with 2 or 3 fingers over the fingers. Do it all carefully and don't pull at the joints, just go a bit over them. Don't pull at the joints. On the other side, do it a few times, not often, 2 or 3 times per finger. And again, you can then switch, do it also from the bottom. You can use a bit more pressure at the muscles here, the finars, but don't pull at the joints. And the other side. Don't pull at the joints, just carefully up. And all at your own risk.
You sit on the ground, tall up, hands at the front, and point the toes, and then bring the legs up. This exercise, doing this is at your own risk. On the ground, and with the feet in front and back, tapping on the floor. Lying with the back on the floor, and don't arch with the back up. Keep lying. You're warmed up, but if you come across this situation, then you could put one hand to the inside next to the foot, bring the arm up, and look up. And you can hold it for 10-20 seconds, and you can come down again. You can also turn the foot into the direction during that exercise. You've got a firm standing leg, the other one goes out with a heel to the ground, and then you lift the leg, but the leg keeps straight. Just lift it up. Down again, up and down. It's an exercise for the middle part. When you repeat this, you can do it slowly or faster as you want to.
You start here next to the brachioradialis and you go with moderate pressure over the middle part of the lower arm, basically over the extensor digital muscle. Going from top to down reduces the amount of irritation at the hairs, but it's anyway still at your own risk.
You have the feet standing together. When you breathe in and you lift the arms up, and you breathe out, you open to one side, just the upper part of the body moves. And you breathe in, you come up again, and you breathe out, you go to the other side. And that's it, just.
First you make a normal step, then you jump up and you point the foot. Try to come like that up, other leg comes like that up. When you change, never moving forward. Perfect.
So when you warmed up, come across this position during exercising, you can put one arm with the elbow against the outside of the leg, the other hand on top of it, and turn to that side. Hold it for 10-20 seconds, not for force, just gentle, and then you can and go down again, but that's exercise. You're sitting taller with the back, you lift both arms up, then you breathe in, and out when hand comes down, you Breathe in and you reach in both directions, not too much. Then you breathe out, lift the arm again up. Again in. Out, your arm down, doesn't have to be so fast. Again in and reach. And out. And down. You have a stable stance. And you bring both arms up and intertwine the fingers. Bring them in front. And bring the arms or shoulders and fingers further in front. Also overhead. And arch the back. Hold this position for around 20 seconds. And do this for 2-3 rounds. When you're standing, you turn one foot 45 degrees outwards. Take the other one up, point it, and tap with the big toe next to the big toe and to the heel. And then 1, 1, 1. Have the hips facing forward. You can do a good amount, but not too many. You have the legs standing wide apart and you're going down into full squat. Bring your arms out to the side. You go down to one side and press with the hands against the lower leg. And you look up to the other hand. When you hold it with quite a lot of force and pressure in one arm, it's an isometric exercise. So you're on the ground and you got something like a tennis ball. And then you find the hip bone and put it a little above, a little bit closer to the belly button. And then you bring moderate pressure on it. And then you leg in and out. In and out. For a few repetitions, around a minute. You've got something to put your feet on. And a towel. And you put your feet onto it. You lay it on. Should be a little larger in the right angle. You take the towel, put it between the thighs, close to the pelvis. You lay down and put a bit pressure onto the chair, wherever you have your feet on, so the hamstrings are engaged. Not much to come up, just engage the hamstrings. You stretch your hands out, palms to the sky, lay down and breathe in through the nose and out through the mouth. Then hold this position, breath out. Then breathe again in through the nose and out through the mouth and hold. You start in plank with both arms parallel in front. When you breathe in, you turn to the side and you reach high up. When you breathe out, come back into the middle. And again in to the other side. Out and down. In and reach the Crescent. So you have the legs standing wide apart. You're going down into quarter squat. And then you press with the hand against the upper part of the upper leg for quite some time and with a lot of effort. Then you do it on the other side. Then you're going down into half squat and you do it in the middle part, again for quite some time with a lot of effort. The other side, of course. And then you're going down into 3/4 or full squat, and then you're pressing close to the knee, again for quite some time and with both hands the upper end. Stand easy but firm, the arms fists in front, and then turn inside. Hold for around 5 seconds. Turn them up, hold for 5 seconds. To the side. And down. You can do another circle or you can go back. There we are. You have the legs standing a bit off and shoulders wide apart, parallel the feet, and you pull with to the inwards of the legs. And you release it. You have a good and stable stance. You have a dumbbell or something else lightweight. When you have it out with a long arm, you take the arm at the triceps, and then you bring it to the outside into supination, and slowly again in. So you go slowly out and in. This should not cause pain, and down to many of them. So you're standing firm, and we want to train the right biceps tendon. So we bring our right arm up. Now we push to the right of the arm, but the left hand first. Then to the inside. Up. Down. Forward. And backward. All for around 15 seconds. You're on the floor, you can do this with long arms on the elbows, and you have one leg out, and you bring it to the side, and again in, and to the side, and again in, and that is a repetition which is repeated. The exercise feels to be finished. With these 4 fingers from the underside of the other 4 fingers, with moderate pressure from the top, down. Doing this is at your own risk. On the ground, one arm with the fingers forward down, the other with the fingers in the direction, and go while you do the exercise down with the shoulder, and then you go further in with the hand. And this is a stretching exercise. And hold it then for half a minute. And continue with the other side. In lunge position, hips facing forward, tailbone tucked in, the arms up and in front, reach and pull them back behind, open the chest. Keep for some time, then reach again in front and go again back. If you are on the way to transition from a sitting position to a lying position, you can do this in a very slow and careful and concentrated manner. You go down, you have initiated with straight back. When you round the back and lay down, you could bring your hands and arms in front to keep a balance. And you lie slowly down. You're sitting, you have an elastic band, a towel or something, and when you go front foot to the outside, outside, and an elastic band that works better. Doing this is at your own. You stand good and stable, and you press with the hands together, and you bring them over to one side, up, to the other side, and down, and you can change the direction. Rather controlled than with full force. Doing this is at your own risk. On the ground, take your legs at the top of the shin bar, and rock from side to side. You go into lunge position, and you have a tall back, and then you pull at the knee with quite a lot of force as an isometric exercise. You're standing with the feet together, and then you turn the first one out, and the other one out, and then with the heel first, and with the heel. Now with the toes, and the other foot with the toes. Slowly concentrate and control. Try to have the weight in the middle. When you've reached the end, you come back in. When you come back in, you can go a bit into the knees. But have always the knee pointed in the same way the toes are. And then up. Lying with the tummy on the ground, and then you lift the legs up and as possible with pointed foot. And you try to do absolutely no muscle work with the other part of the body, just with the legs. And down. We have the feet standing together. You intertwine the hands, the fingers behind the back. When you're leaning in front with strong core, you bring the arms up, high up. Then you can go a bit into the knees, and you bring the arms up. Strong core, and then bring the arms just down again, just straighten again. The feet are standing shoulder width wide apart or together. Then you lift the arms up, you overcross the arms and you intertwine the fingers. And then you just reach high. And you might also change the arms into the other direction. The stand with the feet is a whole lot bigger than shoulder width apart. And when you go to the side, and to the side where you go, the elbow goes down and the other arm. And then this, you can do it a little bit higher, or a little further down. You're doing this when sitting. You can lean a bit back and you lift the leg up and you can hold it as an isometric exercise, or you can also change quite fast, and you can also, if you like to, just relax back and lift up. You can change fast or slowly or whatever. You're on the floor, you have the legs like this. When you come up with the hip and then with the middle part of the back, and then change up the hip and up with the middle part of the back, but not with the shoulders. You can lie down with the head. You're sitting on the ground, you come tall up, you flex the feet, and you go in front and pull them a little bit in, and you stretch it away, and you can interchange between having a straight back and a round back. And don't go to the outside of the legs, but more to the inside, as a leg stretch is this intended. Feet a bit apart, have a good mobile stand, and go to the side, and the back and neck turn with the arm, and then over to the other side, back, circle, and other side, back, circle, and to the other side. The standing leg points forward a little bit to the outside, and the other leg goes back with a flexed foot, and everybody goes in front and then back. All slow in a calm manner. The hips point forward. Lying on the ground, legs up into the right angle, the arms to the side, and down with the legs to the side. And back up and down. You can lie with your head down and look to the other side. You can also stay in this position for longer time and stretch. Now, this position to going to the side, do this only gentle, because this works as a lever and can put a lot of stress onto the tissue and can damage it. It's only soft and gentle. You have the feet standing quite wide apart. When you bring the arms out, you breathe in. And when you breathe out and you shift over to one side, when you breathe in again, come back into the middle. And you breathe out and you go over to the other side. When you just repeat it, you breathe in and out over to the other side, and then so on. On the ground, one leg out, kneeling on the other, straight up, arms to the side, fingers up and down, and maybe not lay down, maybe do, and up again. The other leg. That's it. So you bring one leg long out with a flexed foot and you bring it down, you can tap the floor, when you bring it up again and down, and that just goes on and on. You bring that foot out and then you pull the toes in, straight leg. Then you release and you do it again, pull the toes in. That's it. You always bring one leg with the knee up, bring it to the outside. When you make 3 steps, the other one up. 1, 2, 3, and the other one. You're just comfortable standing. When you bring both arms slowly up, and when you lift shoulders high up, and then you gradually release the arms and down. And again, you bring the arms slowly up, and you lift the shoulders high up, and you let the arms slowly down. And let's mix this. You're on the ground and you bring the legs up into a right angle, and when you press with the hands against the knees, you can lie down if you want. You have a good stance, and you go a little bit forward, also with the shoulder blades in forward, and with the arms back. Keep this position with the shoulder blades. Try to lift the arms as high as you can and together. Then straighten up and turn the shoulder blades down. And try to go still as high as you can with the arms and together. Now try to bring shoulder blades as far as you can down to posterior scapular tilt. And then gradually release. You can repeat this in front, shoulder blades forward, the arms back, try to go as high as you can and together. Then straighten up, try to keep the hands as high and together as you can, and bring the shoulder blades together and down. Then gradually release. You have the feet standing a bit more and shoulders wide apart, the toes are pointing a bit to the outside. When you go to one leg and to the other one, you just rock from one side to the other one, and you always lift the heel up. And that's all that I'm doing for some time. You can have the feet standing together or shoulders wide apart. Then when you have the arms up, you can breathe in and out. You can stretch back both arms long and you open the chest to the sky. And again, and somehow down. This exercise can be done if you, during the yoga exercise, come across this position. Then you can lift the arms up, you can breathe in and out, and you can bend forward and reach up in front. Then you can bring the arm to the side and then back, the palms up. You can also press the shoulders together. You can take the arms again up and you can end this exercise. Sitting on the ground, feet together, the toes in, torn up. You breathe in, lift the arms up, and out you reach in front and go in front. And after some time you can tuck the chin in from the chest. You can reach for the front, and you can breathe in, and you can come up again, and down. You're on the ground, have both legs in, and then you let one fall down to the side. The other one stays. And let it stretch. Feet a little bit more and shoulder width apart, shoulder width back and both shoulders aligned. The arm a bit in front, the elbow slightly bowed. Gradually flex the biceps. And slowly extend the arm and go into wrist extension. And hold it there for around 10 seconds. Keep the biceps flexed and try to have a good alignment of shoulders. Then slowly come into the middle and go into wrist flexion. And hold it here for another 10 seconds. Try to have good posture and the biceps flexed. Then come back into the middle. Keep it still flexed. Hold again and gradually release. Again to the other shoulder, other arm. Stay easy, shoulder back, arm in front, slightly bowed. Flex the biceps and slowly extend the arm and go into wrist extension. Keep the biceps flexed. Hold it for 10 seconds. And wrist into normal position and into wrist flex. Back into normal. Slowly get the arm in and gradually release. So we want to rehabilitate the rectus femoris of the right leg, so the right leg is behind in the split stance, our feet pointing forwards. So we go a little bit back, and then front, and we push slowly off. We bring the heel up, then the leg up, then in front, foot flexed more or less, then behind, and the toes first, and then down. Then repeat. Forward, bring the heel up, foot flex, leg in front, back, toe first, and down. So you have such a bar when you hang, you lift the knees up, when you go to the side, and down, when you can repeat. Doing this is the You're on the ground and you start with one foot. You bring it into E version, the direction. This is inversion, this is eversion, that foot. And then into plantar flexion. And then you hold it there. And then you bring it into inversion and into dorsiflexion. Hold it for a long breath. And then again back into eversion and into plantar flexion. And hold it again. And then inversion and dorsiflexion. Also with the other foot. If the foot cramps, you can embrace it as a good sign that you're doing the exercise right, or you can take the feet and bring them in to release it. A wide stance. Your feet are pointing a bit to the outside, and then one at a time up with the heel of the foot. The arms can go up or down, or can just be in the middle. When you've come from high plank down into a push-up, you can bring now the legs one to the side, the other one to the side, always to the outside, and tap with the big toe. Now you start in tabletop, and then you bring one leg out in one hand, and you have a flexed foot, and you bend the leg, and you take it at the ankle, and then you bring the foot up, and also the head, and you breathe in. Then out, and back, and down. You're just comfortable standing. When you bring the arm to the side with the fist, you have good aligned shoulders and a good feeling in the arm. Then you bring the fist down and up. You go with a little effort as far as you can go into the direction. You hold it for a little moment and you slowly turn around. And then you go again the other direction. Hold it for a slow moment and slowly turn and go. You go into 90-90 lunge position when you press with the hand against the inside of the knee. It's an isometric exercise with quite a lot of effort. You have the feet standing together, then you breathe in and lift them up. The hands. Out and down. In and out. Out and down. Doing this exercise is at your own risk. You have the feet standing together, you breathe in, lift the arms up, and you come up onto the toes. Out and down. And then again, in and up. Out and down. Doing this is at your own risk. You intertwine your hands behind your back. When you lift the arms high up and you bend forward. When you straighten up again, starting at the crown of the head. Let's exercise. You stand good and stable. When you press the hands together and you go over to one side as far as possible, then up, down, straighten the elbows completely, over to the other side. You don't have to do it with full force, lower controlled, back, but you can do it also to the other direction. Doing this is at your own risk. In a wide, but only a middle deep squat, and then one leg comes in, and after some time, the other one, and that is then repeated as often as it's liked. You have a good standing leg, you bring the other leg up, and then again down. and again up, and again down. And you have a flexed foot a bit higher on the upper leg, slightly down, stem onto the ground. And this is just the exercise, concentrated in the rhythm. So up, concentrated down, up, and concentrated down.
Now you have here these points on the lines, and these are you running up. It's also possible to have specific rules how you should run sideways or whatever to all the points.
From tabletop into high plank, and then you can go back, and again in front into high plank. And you go back and out. You breathe in when you go back, and out when you go in front. This is repeated. So you make a big step. You bring one leg long out, the toes are pointing forward. Then you stretch the leg. You go with here down, and you stretch the leg. That is a stretch. You will intertwine your fingers behind the back. Then you bring them over to one side, and you bring your shoulder down that one. Then you turn the head to one side, and you bring the head down. And that's the stretch. You have a good and stable round shoulder with wide stance. Breathe in, lift the arms up. And then breathe out and go to one side. And breathe again in. And out, let one arm down. And look up to the head. And breathe in again. Bring the head again up. And then same to the other side. Breathe in. Out, one hand down. Again in. Out, down. And look up. And again in. And the hands up and down. You stand good and stable. Then you overcross your arms and intertwine your fingers. And you breathe in and lift the arms up. And you breathe out again down. The other way down is also possible. And if you do this, then it's the video. If it happens that you are in the downward facing dog, you can then go high up on the tiptoes. And that is the exercise of being higher on the tiptoes in basically the downward facing dog position. You have your feet standing together. Then you breathe in and lift the arms up. And out one arm down. And in and up. Out the other one down. In and up. And again down. You can change the breathing, but doing this is at your own risk.
You have such a bar, and then you hang, and then you come up with the legs, but just with a movement from the pelvis. So not the legs up, but move just pelvis in front and back. And again.
You have a tennis ball or a sock or something, then you bring it out to the side, and you drop it and you catch it again. You make it a bit easier by throwing it a little bit up, and you try to have a straight arm. During the exercise, you go further in front. You can do it slowly, with many drops and catches, or a little bit faster, however you want. Lying on the ground, then you intertwine the hands behind the back, and you come up with the upper part of the body, and also the legs pointed for shoulders back, come up, and also up, and side up. And it exercise. If you want up, you can, when you're coming from the downward facing dog, high up leg, and you have brought it in front. You're up, you can be straight up, you can bring the arms up while breathing in. When you breathe out and reach in front. And when you breathe in and bring the arms to the side. And out you bring them back and the palms are facing upwards. You stay a bit in that position. When you breathe in again, bring the arms again into the middle. Out and you reach in front. Breathe in, come up. And out and down, and then you can add this exercise with this exercise. You're lying on the ground and you have a bit space in the lumbar spine. Then you have your legs in and they are even positioned, left and right. And when you start to bring one leg out, it's with the power from the psoas, and not so much from the hamstring, from the psoas. You flex pelvic floor and try now with strength of the psoas, and not so much with the hamstring. bring the leg out and in again. And out, in again. Only as many repetitions as you can do controlled and concentrated. You're sideways, one foot is a little bit more in front than the other, and then you bring the weight on the forward leg and back onto the leg which is behind. And you just rock behind and forward. Behind, forward. After some time, change the leg. You stand good and stable, and you have a tennis ball which you grab like this with these 4 hot fingers, and you hold it like this, and you press with moderate force. The roof of the hand is flat to the sky, and it's all one line. And you release again. You press with moderate force, hold it for around 5 seconds, and then you release again. You press, here's a straight line of the wrist to the elbow for 5 seconds, and then release again. You stand stable and easy, and you bring both hands out, and then you turn with the flat palms up and down again. You go only as far as it comfortable goes. You go into that position with a little effort, and you hold it slowly for a little moment there, and you slowly turn around into the other direction. Go as far as you can go, hold it for a little moment, slowly turn around into the other direction, and then turn around again, and go as far as you can go.
You hang on such a bar, and when you lift the knees up, and again down, and down, and down. Doing this is a down.
You're in easy pose with the legs crossed and a straight back, and then you just lean in front. Without any stretching in front, or without any hanging down, just leaning a bit comfortable in front. That is all. Whether this stretch works or not depends on your flexibility, but you can just lie on the back and then cross the arms and lift them in. And if it works, you stretch it. Have a good stand on the ground, and out of the arms, and bring them behind. Turn with the shoulder, but not with the hip. You can breathe in, and you come in front, and out, and you go back. You just go slightly pinching over the trapezius muscle, just a bit up and down, all relaxed, not too much, and all at your own risk. So this exercise is done when you're down, and when you take the hands to the elbows, and then you just gently rock or swing gently on one side to the other for a few seconds. That's the exercise. When you're standing, the first foot goes out, but only taps the ground with the big toe, and then back in. And then the other leg, out, but only taps with the big toe. And then we both do it one at a time. Standing or seated, but when seated with a straight back, take one arm behind the back and relax all the muscles here. Sit straight. The arm and bring it slowly to the side. Only as much as it goes. Try to relax all and just stretch. If you want, you can look now up to the left. For around half a minute. Slow it back. The other side. Arm behind the back, all relaxed. Arm up. To the side of the head, straight back. All relaxed, nothing with violence. If you want, up to the right side. So you are in high plank when you bring one leg in to the outside of the head. When you can keep for a time standing like that, when you can bring one knee down, and you can go also down. This is how you will have a stretching exercise. You're on the ground and you bring one leg in front, with the heel on the ground and the toes are up. You pull the toes towards you and you lean a bit in front to stretch the leg. Then you contract in intervals the quads for a few seconds, 10 seconds or 5 seconds or 20 seconds, and release the contraction of quads. And you do this in cycles. You can bring leg a bit more to the inside or to the outside to change what hamstring is stretched. You have the feet standing wide apart. You bring the arms into the middle. You breathe in and go down. Then you come up and you breathe out again. And you expand the chest to the sky. Then you breathe in again and go down into a squat again. And the cycle begins from the beginning. You breathe in, go up and breathe out. In and out. You can do this also faster. You just breathe in and out again. In again and out again, or slower. You breathe in and out. In and out. So by this exercise, you're lying with the tummy on the floor. You have the arms in front and you breathe in. And you lift up and you draw the arms back. You breathe out and go again in front. And you can repeat it. You breathe in and go back. But that's the exercise. You're sitting on the ground and then you lean back and you bring your legs up. When you bring one leg closer in than the other one, take your arms like this and now you turn and press with the elbow against the knee. And that is the exercise. You're comfortable standing. The legs are a bit more than shoulder wide apart. You bend your knees slightly. And you bend forward with a neutral spine position with a straight back. You let your arms hang. And when you bring your shoulder blades together, and then also the arms up, and you take a deep breath in, and out again, and release again. Then you come up, and then you can repeat it and another set.
You have such a side here, and you start to the side, go over squats, and then to the next side.
So this exercise goes like this. Left arm in front, right behind, left leg behind, a little bit down, and up with the left leg and the right arm in front. A bit down and up, down and up, down and up. So the right leg, this movement. On the other one. On the ground in tabletop position and then up into the floating tabletop and back into the downward facing dog. Back into floating tabletop and back into the downward facing dog. You can repeat this as often as you want and not as slower and stay in each of the two positions for quite some time. So you're just standing comfortable. And when you make a long arm, now bend in the elbow, you make a fist. And then you bring the fist in front side flexion the arm. When you hold it all strong, now bend in the elbow. And after around 5 seconds, you come into extension, so with the hand back, and you flare the fingers. When you hold it again for 5 seconds, when you change again, you go in front and flexion with strong fists, so you're pressing the fist together. And you have now bend in the elbow. When you change again, back. And that is the exercise. One foot in front, the other up, always when the foot comes up, pointed. And this comes up, pointed, this comes up, pointed, in front, that one comes up, pointed, and back. You can also stay on tiptoe the whole time, except when it's concentrate. This can be done if you're down, and then you can do that. So you down with the arms and you simultaneously come up with the back and with hands to the side and up together. That is it. You're generally warm up. You have one leg in front. Then you bring the arms up. Then you breathe in, reach high. And out reach in front. You take the arms back. And you come up onto the front leg. Now you could also turn around to one side, keep standing back, and you can go back. And other different ways. You have a good standing leg, and then you swing the other leg back and front, back and front, back and front. Doing this exercise is the arm. You stand good and stable, have your arms to the side, and you bring them together and up again. Together and up. You can add that you draw the shoulder blades and your back together. The feet are around shoulder width apart. When the arms are to the side, and you breathe deep in into the chest, and you try to reach as far out to the sides as you can. Then out again, and slowly and calmly in again. You try to reach as far as you can and to breathe in as deep as you can in the chest. Try to get as much volume into the chest as you can. Do this also sitting down with a straight back and breathe in. And try to reach and open the chest. Out, slowly, calmly. And out. And in, deep. Reach to the sides, straight back, open the chest. The feet are around 1.5 inches apart. And then you go up just with the heels and the opposing arm always a little bit. You bring one leg up and then you circle the foot. You can also change the direction. On the ground in tabletop position. Now bring the back up the middle part between the shoulder blades. As high as you can. And now keep pushing into the ground with the hands. And lean back. Keep pushing into the ground and lean back. Keep pushing into the ground and lean back. When you come forward again, ready for another repetition. The feet's a bit more than shoulder width apart, but in the knees take place with the arms and come up onto the tip-toes. Again, up onto the tip-toes. You're generally warmed up with one leg in front when you bring the arms up. Then you breathe in the reach high and to breathe out in the reach in front. Then you bring the arms to the side. Breathe again the arms in front. And then you come up and back. You have one hand bent with the elbow and the hand flexed. So the hand to the inside and with the bended elbow. With the other hand, you press then into the hand and you extend the arm while you extend also the hand. So the elbow extends during the exercise and the wrist extends. And you go with the thumb from here up to here, and another time you go a bit here, and a bit here, and also from here to here, and something like that. With moderate force, not too much. Pain should not spring up. So to the inside. So you come here, flexed hand, you extend the arm, extend the hand, you go up, also to here. And now a bit more on the inside. Here you extend the arm, extend the hand, and you move up. You have a good stand on one leg, and when you turn to the leg as far as you can, then hold it 5 seconds. Then go down and turn to the other side. And come back up. You can repeat it. Go onto the leg, go to the side, hold it, go down, and turn to the other side, and come back up. Down across the arms, open the arms and the leg, swing the leg in and the arm, open with the leg, down across, open with the leg, swing the leg in, open with the leg, cross down, open with the leg, and swing in, open with the leg and cross down. You can make this slower and linger in a position, or you can make it quite fluidly. Open with the leg, swing in, open with the leg, cross down, open with the leg, swing in, open with the leg, cross down. So for this exercise, you're lying on the floor and you have 3 objects, one on eye height, one on shoulder height, and one on hip height. When you have the other arm in front of you and you look forward and you bring one arm out over it, the hand faces the whole time to the floor, and you lift it over, but always slowly and concentrated, and you lift only the arm up and you keep lying with the chest on the floor. Here, and the last one, with hold, slowly and concentrate. And you lift only the other. First you approach the situation. You go down into the high plank, then into the downward facing dog, and put the left leg up. Then in front. So, and here comes it. So we take the arms in front, take them up, and when we go up, the left leg goes a bit up. When the arms circle again into the front, the leg goes down. So like this. Now the other leg, a more simpler approach, but it doesn't warm up so good and you should be warmed up. So now the other leg behind, up, circle, straighten the leg a bit, and down. You have the feet standing together, maybe with an inch space between them. Then you breathe in and you lift the arms up. And you breathe out, you have the arms far back behind, you bring them in front, and you sink down into the chair, the weight in the heels. When you breathe in, you come a little up. And out. Again, in a little higher. And out, again down. And then you breathe in and you come up. And down with your arms. Sitting on a chair, and then hang through, and posterior pelvic toe. Then lift the left leg a bit to the outside, and a bit in with the foot, and then press the right hand against the inside of the left knee. And straighten the back, anterior pelvic tilt. Keep this muscle activated, psoas, and slowly put it down and keep the muscle activated. And then release it. We are. So hang through with the back, posterior pelvic tilt, lift the leg, bit to the outside, press against it, straighten the back, anterior pelvic tilt, keep the psoas activated, slowly let it down, and release the psoas. So you're standing good and stable. You make long arms and the hands form to fists. You stand tall, and you bring the scapulas together, and you open the scapulas a little bit to the sky, and you open the chest a little bit to the sky, and then you turn the arms backwards, a bit under pressure. Then you hold it for around 5 seconds, and then you turn the arms in front, but you keep the scapulas in their position as they are. So back together, a bit open to the sky, and the chest a bit open to the sky. And then you switch again. The arms are turning backwards, scapulas are pressing back together, chest are opened a little bit to the sky, and the scapulas also. And then you change again with all 3, 4, 5, 6 cycles. So the scapulas back together, scapulas slightly open to the sky, and the chest open to the sky. On the ground, in plank position, straight back, and then go to the left with hip, and to the right, and to the left, and to the right. Repeat as often as you like. You have a stable, good stance. You bring the arms up, cross them the fists, and you are down towards one hip. When you do this, you flex the abs and the whole core. When you go down. And the hip rather moves towards you than out. Around 50 to each side. On the ground, one leg out, the other leg on top of the other. The elbow against the knee, turn to that side. Press with moderate force against the knee, but turn only gentle, because the muscles can bring up more force than your tissue can hold. Stay in this position for around 30 seconds with pressure, then continue with the other side. You have a good and steady stance. Bring the arms up to the side, you bring the shoulder blades together, down, and then up to the outside. Together, down, up. And go not so much in front, but rather high up. You bend the arm and you extend the wrist to the outside. Then you start somewhere here, and you extend the arm, and you even make a fist and bring it to the inside. So the hand makes this movement from the outside to the inside of the fist. And the arm stretches. So start, hands open and extended wrist, extend the arm and make with the hand a fist. And with moderate pressure, down in different areas. So you can start here and go up here, 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 and here, a bit up even more. So start with the extended wrist, and you go down, make a fist, and you move up. Just to go to stable, a bit more of a shoulder wide apart stand, and then you lift the arms up, go a bit down, and again down together, across a little bit, up, across again, down, and then you can add when you want, bring your hands together, and down. You have the legs standing wide apart. When you go down, not completely down into full squat with 90 degrees, but a little bit higher. You have quite a wide stance. When you come up onto the tiptoes, and up to the tiptoes, and try to come in front towards the big toe with the weight. And you repeat this as long as you can. Sitting on the ground or on a chair, you take your leg and you bow forward with head, shoulders, around the back. And then you go more in front and head to do this with the leg. And this intends to stretch the trapezius muscle. You take the bar right, then you come up over to the side, and you go up to the side, and so up. You're on the ground, bring your legs up, and when you reach up to your toes, then you hold it. You have one leg far in front, you turn up, and you have both arms up. That's it. Warrior 1, Warrior 2, and Warrior 3. You've got a backpack, maybe with books in it, and then you take the bar from behind, and then you come up. For weighted pull-ups, you just have a backpack, maybe with books in it. When you hang, you just pull up, just something in the backpack. Stand up forward, lift the bar from behind, hang down, you take it wide, parallel bars, then you pull up into the middle. Make sure that you don't mess with the head against something. Instead of shoulder wide apart, you took it wider, hang with extended arms, then you pull up and you go down again. The feet are more than shoulder apart, then you do this in different positions. Be aware of the effects this has onto the biceps, triceps, AC joint, shoulder overall. And if one of them includes damage, you can also do it in pain, then don't do this exercise. You have a bar, and you hang on it, you lift the knees up, straighten the leg, and in and down, and then repeat. Leave long and down. Doing this is a down.